All right, so we got a really good and important study here from Public Citizen, which is basically just outlining how they've looked at the data and seen that massive amounts of the damages caused by the COVID-19 pandemic could have been prevented in the United States had we have had some sort of a single payer system or adopted the policy of Medicare for all. So this is really important, even though it looks like we're going to get through the entire course of this pandemic somehow, with Medicare for all never really being on the table as a piece of legislation. Obviously, we didn't get Bernie Sanders as the presidential nominee, so of course that was going to be the case with a corporatist like Joe Biden, who serves the private health insurance industry, who serves the big pharmaceutical companies. So even though we're not going to get this through the legislative process immediately, it's super important to look at this data and understand the reasons why a for-profit healthcare system makes absolutely no sense, and why, to be prepared for future pandemics, we should adopt a single payer system moving forward. So Public Citizen analysis: how for-profit healthcare worsened the pandemic. Hundreds of thousands of deaths and millions of infections would have likely been prevented under Medicare for all. So a new white paper by Public Citizen lays out how the for-profit healthcare system left the United States vulnerable and unprepared for the COVID-19 pandemic, and how a single-payer government-run healthcare system in which all Americans were covered would have helped the U.S. response to the crisis and prevented thousands of deaths. Quote, the pandemic has shown how wide the gaps in our healthcare system remain and how easy it is for families to fall through them. Too many Americans were already suffering the unnecessarily prior to the pandemic, and COVID-19 just exacerbated the challenges people face, said Egan Kemp, Public Citizen's healthcare policy advocate. We already spend far more than any comparably wealthy country on healthcare while achieving far less, and we're left wholly unprepared for the COVID-19 pandemic. So this is not really complicated, okay? The reason why our healthcare system is so much more expensive and less efficient while providing healthcare for a less proportion of our population. Every other major developed country, wealthy country around the world, has some form of single-payer system, has a universal healthcare system where they are at least somewhat providing healthcare as a human right. Here we provide it as a product, as a commodity. And so, of course, when you have healthcare companies, and big pharmaceutical companies too, whose entire priority is profits and their profit margins instead of providing healthcare to everybody who needs it, of course you're going to end up with a situation during a public health crisis like COVID-19 where your response is going to be disastrous, because you have all of these giant for-profit companies that are trying to prioritize their profits in the middle of a time where we need to be prioritizing public health. So obviously you're going to see some of the consequences. What were the specific consequences that we could have seen prevented? Well, here we go. The U.S. remains one of the only, like I was saying, 25 wealthiest countries not to provide universal health care, and the healthcare system's focus on profits and not health has cost Americans their lives. Despite having just 5% of the world's population, the U.S. has had 25% of the world's confirmed cases and 20% of the deaths. Public Citizen's new report demonstrates below that before the pandemic, this is mind-blowing, before the pandemic, approximately 87 million Americans were uninsured or underinsured. About 1/3 of COVID-19 deaths and 40% of infections were tied to a lack of insurance. 40% of infections, 1/3 of deaths could have been prevented had we had treated healthcare as a human right, had we have given every single American access to the healthcare that they need. 1/3 of the deaths, okay? We're talking about a country with the worst COVID handling, the worst outcomes of any nation on earth. Okay, over 500,000 dead Americans. 500,000. 1/3 of those could have been prevented under a single payer system. So we see the direct material effects of having the profit motive prioritized over public health. It's massive. It is a gigantic difference. Okay, so it's really important to hammer that in. How big of a difference a single payer system could have had in our handling of this pandemic and also the handling of future pandemics. Okay, so when this next time comes, if we are similarly unprepared, we're going to be wiped out in the same way that we were with COVID-19. This is ridiculous. 1/3 of COVID deaths could have been prevented. 40% of the infections, and who knows what the long-term health consequences are going to be for people who have had COVID but didn't die from it. We don't even know what those long-term consequences are going to be. But this shows you how much of a direct impact it could have had. About half of Americans receive their healthcare through their employer. Obviously, with people losing their employment during a public health crisis, there's less business activity going on. Businesses are laying people off. With more than 22 million Americans losing their job during the pandemic, millions of people lost their health insurance. Think about that. Millions of people losing their health insurance at a time when you need them to have it more than ever. So just another one of the ridiculous aspects of our for-profit healthcare system. When you don't treat it, when you treat it as a commodity instead of treating it as a human right, people lose it when they lose their employment. That's absurd. Racial health disparities, including access to care, have led to disproportionate deaths in communities of color. We've obviously been seeing COVID hit minority communities significantly harder than white communities, as well as with the vaccine rollouts. We've seen white people, and specifically wealthy white people, get access to the vaccine in vastly disproportionate amounts when compared to minorities and communities of color in this country. So you're facing the harshest outcomes in addition to getting the least amount of help. That's what happens with our current system right now. We have the highest rate of unmet need of any comparably wealthy country, with 1/3 of Americans reporting that they or a family member has avoided going to the doctor when sick or injured in the past year due to cost. So this ties into the same idea. You can have uninsured people, you can have underinsured people, and then you also have people who won't even go to get the care at all, right? So it's not even just that people are getting ripped off when they're going to the doctors. It's not even just that people are having to pay ridiculous costs for expensive health insurance plans that barely cover them anyways, but it's that people put off that care at all because they're worried about the associated costs. And when that happens, you have illnesses that build up over time, and then they get worse. And then you have people who have to end up going to the emergency room when it could have been a problem that was tackled at the root cause of it by regularly going to the doctor. And then you have more expensive outcomes, less efficient outcomes, and worse health outcomes as well. So doesn't make sense at all, but that's our current system. Americans are significantly more likely to die from chronic respiratory disease, cardiovascular disease, diabetes, or cancer than people in comparably wealthy countries with universal healthcare systems, and a lack of essential funding led to insufficient hospital capacity. The U.S. had only around half the hospital beds per capita of peer nations and far fewer than countries like Japan and Germany. So, yeah. This study is important. It's really important to understand what this study is saying. We need a single-payer Medicare for all system in this country, and we need it right the fuck now, because this isn't going to be the last pandemic. All right, it's extremely absurd that it's unacceptable, really, that we're going to end up making it through this entire pandemic without Medicare for all being enacted or even really being seriously put on the table. That's pathetic. It's unacceptable. We're the wealthiest country in the history of the world. We can afford this. Medicare for all is, according to many studies, cheaper than our current system. It would be cheaper. It would lead to better health outcomes, as we see from studies like this. And if we're going to be able to handle the next pandemic, we're going to need to be able to be equipped to do so. And so this is the steps that we need to be taking. These are the steps that we need to be taking. And that's moving us towards a single-payer healthcare system. I did a video a couple days ago which was talking about Pramila Jayapal reintroducing Medicare for all to the House in 2021. So we got to keep up the public pressure. It's totally fucking unacceptable that we have a president of the United States and Joe Biden and a Democratic establishment where you can go down the line and pick everybody who's against Medicare for all, Nancy Pelosi, Chuck Schumer, et cetera, et cetera. It's totally unacceptable. These people are being bribed to deny Americans healthcare, and we see directly the consequences of this.